This is the presentation of the paper Digitally Mediated Schizophrenia Care, a Swedish case of translating, designing and expert evaluation of Dialog Plus. My name is Bertil Lindenfalk and I work at the Jönköping Academy for Improvement of Health and Welfare at the School of Health and Welfare at Jönköping University. This paper is co-authored with Andreas Gremyr, Marcus Lundmark and Torbjörn Jakobsson. And during this presentation I will focus on the expert evaluations that we have conducted of the initial phases of the design of a Dialog Plus app for Swedish schizophrenia care. People with severe mental illness, such as schizophrenia, live 10 to 20 years shorter than the rest of the population in the OECD countries, according to a report by OECD in 2017. And this made us curious about, or wanting to do something about this, trying to attack it from perhaps a different angle. Two reasons appear to be central for this. First, it's a low adherence to treatment, so meaning you don't follow your treatment plan, you things like that, or you have little medical attention for when a person is suffering from other chronic conditions. And in Sweden, we have the Swedish Patients Act, which specifies that the patient should be involved and empowered through their care process. However, we still see within schizophrenia care that treatment and follow-up do not seem to be characterized by patient participation. And why that is, we're not really sure. Is it because of how we treat patients, or is it because of something else? But our aim and hypothesis was that, okay, so perhaps we can do something within the actual treatment, the actual session when a patient meets a carer. And that is where Dialog Plus comes in. Dialog Plus has been around for a while and is a conversational methodology used during patients' visits. It is supported by a digital application in most cases, and it was initially developed by the NHS in East London. And so far it has been tested in over 15 countries, specifically for more severe mental illnesses, and which schizophrenia is one of them that has been tested for. However, yet it has not been tested in Sweden, not on a large scale. And this is something that we wanted to address. Because previous studies have shown that the use of Dialog Plus in routine care provides more effective treatment, increases participation, and is more cost effective than regular treatment of good quality. And this is, of course, if this can be achieved, this is, of course, very good results, also here in Sweden. But with previous studies, it was emphasized that the patient and carer perspective also show that Dialog Plus provides a comprehensive and solution-focused structure and initiate domain-specific change in routine meetings. Which goes back to that first point. Can we achieve this? Perhaps we can then do something about that first point of having patients to stay closer to their treatment than what is agreed upon between carer and patient. And this work got funded from the local innovation platform in West Sweden within the region Västra Götaland. And a small group, which are the authors of this paper, initiated development of a Swedish version of Dialog Plus. So we were a very small team conducting this work initially. And being able to then test this application and things like that. we quickly decided that we wanted to conduct this work using human-centered design principles, methods, and tools. We acknowledge that not only should we have patients, of course, more involved in their own treatment plan, but we should also have them involved and they should have a say in, okay, so how should this digital tool look like? How would it work best? But we also acknowledge that there's an ethical aspect to this, and that we couldn't involve users too early in the process, because we didn't want to see that or have them believe that they were in sessions when they weren't. So instead, we focused on the classical aspects of identifying user and specify the context. We specify the user requirements. We produce design solutions using wireframes and mock-ups of various granularities. And then we also evaluated design solutions against the requirements, in which we did then what is here presented as the expert evaluations. So the main focus of this presentation is to present the results of the expert evaluation of the Swedish version of the Dialog Plus application. Of course, following human-centered design and human-centered design principles, user testing is on the horizon and is actually ongoing as I'm speaking now. So we are still engaged in those types of activities. However, instead or during these conversations and during the development, we had regular contact with the Swedish patient organization for schizophrenia care, so the national one. And just to give you an idea of what the app looked like, so I'm not going to go into deep what Dialog Plus is and how it actually works. You can find this out in the paper if you want to, or there are other resources that are much better of presenting that material. But this is the landing screen for a carer, where you see, so the purple headings is what we have translated into English. So what you're looking at is the actual Swedish version of this application. So we have the first name and the last name of the patient. We have their social security number, and we have their last treatment session. We also do have a report card, more information about the patient should the carer want that. We have, of course, to start a new session or start a Dialog Plus session. We have a plus, so you should be able to add new patients as a carer. Up here, we have the carer's name, and we have a menu where you can find a manual for the conversational methodology and things like that. So once you start a session with a patient, you come to this here site, and here you have the name of the patient, so up here, and you still have your carer name and your menu over here. We have a breadcrumb trail of the process over here, so you should always know where in the process you are, how many steps you have done, and how many steps you have left. And this is, of course, considering the target group and the carers for that instance as well. Down here, you can see what has been agreed upon last time. So in terms of, there's 10 domains within the Dialog Plus. I'll get back to that in the next slide, but this one's then is for physical health and for accommodation. And for instance, under accommodation, the patient should look into possibilities of switching accommodation. There might be something is not right there and would want to move. So this section here is to bring a little bit of information. Okay, so what happened last time, in order to be able to move into the actual assessment then. And here you have 10 categories. I've inserted here also the English version of the app, just for reference for you. As you see, it's quite similar in appearance and functionality. We have collapsible menus instead. So in order to just focus on one of these, so this is the physical health aspect up here, but you still have the totally dissatisfied to the totally satisfied. And yes, I would need help in this area, or no. Once you fill that in, it automatically pops into the next one, so to say. Then you get into the what to focus on today, and here we see the blue ones are today's assessment, so what you did in the previous screen, with numbers, and then you can compare them by ticking a box up here with a previous session of the source. And here you can choose whatever or whichever session that has previously been taken. So you can see the difference between this overarching. We have also color coded these because we believe that might actually help in being able to differentiate between them, both from a carer and patient perspective. I'll get back to that when we come to the evaluations. If you want a specific graph over time, you can just press that graph button over here, and it is the carer's responsibility during this screen or this step to actually ask if this is something that you'd like to discuss today. In the next, then, there's a 4-step process that the carer should go through together with the patient in order to write down if something specific should be done or if you agree upon something during this session. And then the final screen is a summary of what you have been talking about today and what you should be doing. What are the goals for the next session, for instance. So this is a summary of how the app actually looks like. And we conducted expert evaluations of this. We had 2 expert evaluators available to us. We wanted evaluators who could represent the conversational methodology, who's been working with the methodology and knew it well. So that is the Dialogue Plus, and is also from Sweden, who knows what it's like to work with schizophrenia patients in Sweden. And in the Region Västra Götaland. So that's why we managed to have two patients, or 2 experts, sorry, that's sufficient according to literature by Nielsen and colleagues. So we did cognitive walkthroughs with them together with Think Aloud protocol, and both experts found the application to be readily accessible, which is of course nice. There were some element states were harder to identify than other. Was a button pushed or not? Navigating the application was never an issue, but on some occasions it could be. One patient said that the color coding wasn't really up to them, but still they kind of accepted it. And the overall impression was, which is of course then the color coding is something for us to then highlighted it for us to test during user testing. The overall impression was that it followed the steps outlined by the conversational methodology, i.e. Dialogue Plus, which is of course what we wanted and that what we were after. So we're really happy about that. And during the heuristic evaluation, and I'm just going to mention a few here, is that we're going to get back to during the user testing, is how specifically the interface felt messy when comparing estimates with each other. So that was the screen where you could compare between the two, and that is a screen that we'll have to get back to and see. Okay, so how does the patient and carer together think about this screen? Otherwise, it was font size needed to be bigger in some occasions, and the dates in the application. This is why you should do expert evaluations, for instance. That they found that, for instance, that the date format was in another format than from the electronic health record, which is of course something minor that we immediately fixed, but it was found during these things. So lessons learned here is that we really wanted, partly due to our target group, is that doing expert evaluations and still being able to involve the patient group or the target group within the work is still a feasible with during these stages of the process, and it should be a good thing to do. However, it is in our experience that this happens less and less. So we wanted to emphasize that again, that this is something good. You can do this, and we encourage it. Of course, going forward in future work is that, as I mentioned, user testing is ongoing, but it also means that Dialogplus has the potential for us to generate proms and prems, which is, of course, what we're really after. And that we should have further studies to explore the psychometric properties of the data generated, so that we can actually support quality improvement of psychiatric services, which is what we're hoping for. So this is ongoing work. So far it has been promising, and it's scaling up currently. We're testing it, live testing it, so hopefully it will be as part of a treatment plan going forward. I thank you for your time for this presentation, and I hope to see you in real life the next time.